Welcome to Medicine Talk ND Live, where you can discover life without medicine. Join us live 12 to 1 CST every weekday, where you can talk to a naturopathic doctor for free and learn more about naturopathic medicine. ND Live is brought to you in partnership with FullScript, the doctor's choice for delivering the safest source of professional-grade supplements to their patients.
Hi everyone, Eli Camp here, the founder of Medicine Talk, and we are talking to doctors who are participating in our ND Live series that we're running, which is Discovering Life Without Medicine, and it's a chance for anybody who wants to learn more about naturopathic medicine, if it's a good fit for you, if you just have questions about your supplements, whatever. We have doctors on the phone 12 to 1 Central Standard Time, and it's free to you. You don't pay anything to call in and talk to them. It's every weekday, some weekends, and so we thought it would be really great if you could actually hear from the doctors who are participating in the program. And today, we're really honored to have Dr. Nina Manipon with us, and you have a practice out in Stamford, Connecticut.
That's correct. Yes, I have an office in Stamford, and I actually have two other locations, one in Hawthorne, New Jersey, and I just started in Fairfield, Connecticut just this past month.
Is it cold there right now?
It is actually cold, and it gets rainy lately, so not happy about the weather. I'm especially being used to being in Arizona there. So.
Oh, that's right. That's right. Mm-hmm. Yeah, so we're doing these interviews right now. It's December. We're in December 2016, and we had fog this morning, but it's turned into a beautiful day. So
great.
So tell us a little bit about how you found naturopathic medicine and why you became a naturopathic doctor.
Sure. Well, I found out about, I only found out about naturopathic medicine probably when I was in my mid-20s. And I was at a point where growing up, I always knew I wanted to be a doctor, and then got through school and I was like, this isn't going to work out. And I switched my major, and it came to a point in time where I thought I was either going to go back to my master's in HR or maybe my MBA. And I guess I can call it like your quarter life crisis, right? Where you're not quite where you want to be and you're thinking about things. So I decided to go see an acupuncturist, and I told her my plans about, going back to school and getting another degree. And she said, did you ever think about naturopathic medicine? I was like, well, what is that? I've never heard of that before.
Right.
And I looked it up, and I was like, oh my gosh, this is amazing. And as soon as I found it, I took prerequisites and then started school a year and a half later, because I had a few other classes to take, like one class while working full time, like a semester, or two classes a semester. And that was it.
And is it what you thought it would be?
I think it turned out to be so much more. Like, my gosh, Dr. Camp, I think it's, a lot of things took me to the path of being in naturopathic medicine. I have a ton of family members that are medical doctors. And for me, it was really losing my parents that was the driving force, because I thought to myself, gosh, there's got to be a better way. There's something out there that's better. And that's what kind of stopped me from going the conventional route, because I just didn't want to have, that stereotype where it's, short visits and all I'm doing is prescribing medication. So the minute that I found naturopathic medicine, I was like, oh my gosh, where has this been all of my life? And I love it. And I think it's amazing.
That's great. That's great. So where did you go to school?
I went to Southwest College of Naturopathy.
You went to Southwest College in Arizona. And tell us a little bit about your practice.
Sure. My practice, so I have a family practice. I see everyone from, my youngest patient so far has been 3 months, and my oldest patient has been 91.
Wow.
Gamut, which I love. So I have a family practice, and mainly women, of course, come to see me first, and then they bring in their kids, and then they force their husbands to come in, or the husbands come up on their own. So that's, my practice. I love it because it's something different and new every day. And for me, it's just really making sure that I get to the root cause and I really understand why patients come in to see me, because they say, I've seen every specialist, I've seen all these people, what are you going to do differently? And I'm like, let me tell you how we're going to be different. And we just go from there.
We do it differently, don't we?
Sure do. Like, I hear so many times patients say to me, like, this is the first time I feel like I've been heard, or this is the longest anyone has ever spent time with me. And
Yes.
that's what healthcare is.
I've had people say to me after their first visit that if they combined all of their doctor visits to date, the time spent, that they had still spent more time with me in one visit. And how can you treat someone unless you really understand their story and what their life is like and their stressors and their job and, you know, the history of their medical conditions? How can you do it effectively? I just don't think you can. So you utilize all the tools of naturopathic medicine.
All the tools. I start with digestion first, and then, you know, typically if I can give a homeopathic remedy right then and there, I will, or if I need to take a little more time. I love hydrotherapies, botanical medicine, mind, body, everything.
Everything.
And my adjustments, of course, but I do everything in a very vitalistic approach, which I'm very proud of, and so blessed and happy that I can do that. And I have really great mentors like Dr. Zeff and Dr. Sensenig and Dr. Hazel who steer me in the right path. So I'm so grateful to them for sure.
That's great. Well, you know, I've asked everybody this question. Tell me what your favorite herb is, and if it's your favorite herb of the month, that's fine. Tell me your favorite herb and why. Why do you think it's such a great herb for people to know about?
Sure. So I guess I'm going to go with yarrow. And I remember learning about it my first time taking my first herbal medicine class. And I learned about it, and it's a diaphoretic herb. It's called Achillea millefolium. So it used to be something that they used to help treat soldiers that may have gotten wounded. And I really liked it because when I first heard about it, anytime I got a fever, I felt like I was getting sick, I would make myself a cup of yarrow tea, and I would start sweating, and I would start to feel better. So I think it's such a great herb for anyone in that cold and flu stage, especially with where we're at right now, to have a cup of yarrow tea. Not too much of it, but just the right amount.
Right. It's a lovely herb. It's a powerful herb in our toolbox for sure. So how can people find you if they want to come and see you and make an appointment?
Sure. Well, they can find me on my website, which is revitalizedwc.com, or they can give me a call. My number is 201-362-3166. I always offer free 10-minute consultations to all my patients. And if they want to come see me in Fairfield, they can contact Ingalls Family Health there.
Excellent. So everyone, you can also join Dr. Manipon 12 to 1 Central Standard Time once a month. I believe that you were on the phone today.
Yes.
Yes, and there were some callers that came in, but they came in either at the wrong time or we have to check that out. So it'll be in about a month. You can watch for Dr. Manipon again. You can always check the public calendar for ND Live over at medicinetalk.org. It'll be on your screen here in just a second. Thank you so much for taking the time, not only to talk to me today, but to spend time on the phone, you know, to talk to people out there who are curious or struggling with whether or not this is for them. And I think it's really important.
Well, thank you so much. I appreciate you, Dr. Camp, so much for everything that you do for vitalism and for really making sure that people know all about naturopathic medicine and getting out there to them. So I thank you so much.
It's the bomb. Everybody needs to know about naturopathic medicine.
Thank you.
Well, I hope you have a great day, and I'm sure we'll talk again soon.
Thanks so much, Dr. Camp. Have a great day.
Thanks, you too.
Visit medicinetalk.org to join us at ND Live today. And be sure to ask your doctor about Full Script.